Let's talk about the concept that we use for making demographic tables. As we mentioned uh, before, we need these basic concepts for making our tables. First, let's look at the table shell. In the table shell, if you look at the title, the subtitle mentions that ITT population should be used. And if you look at the contents, you will find these variables such as age and sex, race, and in other tables you might also find the other baseline characteristics that are listed in the table shells. And in the content area, you also see there's a p-value. This p-value is uh, optional, and sometimes you do see that is required, and sometimes you don't have to do it. But in our homework for this class, we placed it as a request so that people can test if there's a difference between the engine groups, and by looking at the statistical model that is used for doing the analysis. So the what is the ITT population? Well, the ITT population is usually defined in the SAP. If you look at the slides, the slide number 15, and you see the entity population is so-called intent to treat. It is defined to include all subjects who have taken any study medication and who had baseline at least one post-baseline measurements for the primary endpoint. So usually if you do the analysis by the ITT population, so that is a kind of analysis, is a strategy that compared the study groups in terms of treatment to which they were randomly allocated. So this is consistent with what we see, but it makes some slight difference between these two definitions, because one definition emphasizes as long as they are randomized. Another definition emphasizes that they must take the study medication, and they must have baseline at least one post baseline characteristics. So, but on the other hand, if you don't have any measurements for the primary endpoints, is all the data for the subject will be missing, and you have no way to do any analysis at all. So that said, the intent to treat a population definition is really kind of a modified, randomized subject group. Anyway, and then if you, in that case, if you define the if you want to define the ITT population, and you need to identify the primary endpoint, and you need to find out the baseline characteristic, the baseline value, as well as the post baseline value for the primary endpoint. So now, how do you define the baseline value? This is a very important concept for any clinical trial programmer. Look at this data. These data listed the few observations from the vital sign, and you have subject ID, and you have DBP, you have SBP, you have visit number, and you have dosing date. So that baseline is defined. If you look at the definition, baseline defined as the latest observation before or on the first dosing date. Uh, be very careful about this before or on the first dosing date. So when you do defi- when you define the dosing, when you define the baseline, the first thing first is to identify what is the first dosing date. When they started the drug, when did the subject start using the drug? So that is the most critical time point you need to find out, and then you use that uh, dosing date as a cutoff date, and to separate your observations on the primary endpoint into two groups. One group is before or on the first dosing date, and the another group is the after the first dosing date. So by separating these two groups, you can compare which one is the last observation. So you're literally looking at the observation that happens before on the first dosing date. So that is the clear definition, and when you get that definition, uh, you get that definition down in your SAS, and then you can start to look at whether you have a baseline or not, and after the baseline you can find whether there's at least one post baseline measurements for the treatment group. So in that scenario, you can get your ITT population done. Now, the another thing we mentioned, the randomization. So another way to define the ITT population is to look at the randomization. And so you can use these concepts to do the ITT population if your SAP says so. So then where you can find the randomization information? Well, for any study, usually you would have at least you would have a randomization CRF. That is actually happens after the screening is done and after the investigator made the decision and gets consent form filled up and then enroll the subject. When the investigator with the site enroll the subject, they randomize the subject and they recorded all the information on the randomization date. So that concept is also critical for any study. So we can see for this another thing is for producing the p-value, we need to identify the appropriate SAS procedures for producing these p-values. For example, for categorical value analysis, you might consider per-freq, and for continuous variable, you might want to consider the perk mixed or perk GM. Now, after we got all these basic concepts of ITT and baseline and randomization as well as the p-value reviewed, let's look at the actual programming steps that we need to take in order to produce our program for making these tables.